Welcome everyone to the Henry Schein webinar series on COVID-19 and dentistry. I'm Dr. Gary Severance with Henry Schein, and it's my pleasure to introduce Dr. David Reznik, Chief of the Dental Medicine Service for the Grady Healthcare System in Atlanta, Georgia. Before I turn it over to Dr. Reznik, I wanted to let you all know that our next session in 2 weeks will be a live Q&A webinar where Dr. Reznik will answer your questions live. To submit questions, please go on the link shown on the screen now. It's also in the description of this video. We've had so many great questions brought up during this series, so please keep them coming. Thank you. Thank you for your attendance and your attention. And with that, I'll turn it over to Dr. David Reznik for this week's update.
Thank you, Gary, as usual. It's always a pleasure to be with you all today. We have a comprehensive webinar today where we're going to be talking about where we are with COVID-19. We actually have some good news there. We're going to talk a little bit about the continued role of asymptomatic and pre-symptomatic spread and why we need to be safe in the dental setting, even when we start seeing the numbers going down and vaccine numbers going up. Continued concern about the variants, so we'll talk a little bit about the UK variant and the South African variant today. A vaccine update. Why do we need 2 doses? What does the booster do? And then a little bit on the new one that might be approved next week, the J&J vaccine. So we're going to talk about that one as it's a 1-dose vaccine, and the phase 3 information will be available soon. So let's get started. When we look at where we are in the United States with COVID cases, we have really come out of quite the peak. The latter part of December, the earlier parts of January, we really saw our health systems overwhelmed. We saw tremendous numbers of cases. And when you see tremendous number of cases, of course, there are going to be bad outcomes for some. And for that, we're always sorry. But if you look as of January 25th, you can see there were 130,000 new cases, and that's much less than the greater than 250,000 cases nationwide we were seeing before. If you want to look by where your state is, and this is just looking at COVID tracking numbers that anyone can do, you can see that in the United States, we've had greater than 25 million cases. There have been 425,000 deaths. Each life is important, and that is sad news, but we have recovered most of our folks. California has been hit the hardest, followed by Texas, Florida, New York, Illinois, and you can see my home state of Georgia does make the top 10. My hospital has been on diversion, but now we're seeing a reduction in the number of cases in Georgia, and that's wonderful news. So hopefully our physical distancing, our masking, and our hand hygiene is working. It's too soon to see if the vaccines are making a difference, but I can tell you that many people that I work with have already had their second dose. I had my second dose of the Pfizer vaccine last week. I can report that the only symptom I really had was a sore arm, and that was about it. And it's going to take me, a good week or two to really build up those antibodies, and we'll talk a little bit about that in a few minutes. If you look at where we were starting with 100 plus cases in each confirmed region, you can see based on this little bit of a comparison. And in this chart, if you access it, you can really pick up 10 states. I always pick up the bigger states in my home state. So Georgia, you can see we've had over 500,000 cases. You can see where New York is and the devastation that California has faced. So it does look like our current wave has peaked. And that's important. If you look at the devastating issues that we had in the fall and winter, that really caused a lot of misery, both for people and for hospital workers. I mean, our frontline workers have really been stretched to the limit because of this. It looks like we're seeing the virus numbers go down. While we could have another surge, and it's always possible, and there's always the possibility of more infectious variants, such as the UK on the horizon, we really have seen a significant drop, and that is wonderful news for all that are involved. But then we have to look at what these new super strains are. I've worked in HIV for the majority of my career, and one of the things that we've always had to deal with is resistance. So we would come up with medications to treat, and then the virus would outsmart us, and then we'd have to add another. And we still don't have a vaccine for HIV because of its ability to change. So right now, since this is a newer virus, and we had these wonderful technologies that had been studied for 10 years, the mRNA technologies, which really allow us to change things quickly should the need come, we literally have vaccines that work. And the UK variant, which has 23 mutations, the South African variant has 21 mutations, some overlap between the two. We do know that our vaccines that we have today are effective against the UK variant, and that is very important to know. What we know about the UK variant is that it is much more contagious, and so that means that, and it's in 20 states now. And so what we're really seeing is not a more virulent, not more disease related, but what we are seeing is it's much more contagious. And so you'll see more people presenting to hospitals and continuing to overwhelm our systems. Regretfully, some of the new CDC data says that the UK variant could become the predominant strain in the United States by March. Again, making it further difficult for us to get this under control. But again, we need to get vaccinated. We need to practice those 3 distancing issues, hand hygiene issues, etc., and masking issues. And I can tell you that in Georgia, where my part of the city that I live in, I would go into a local grocery store and there would always be people without masks in the store. For the last several weeks, whenever I go venture out into the store, everyone is wearing masks. So I think we're getting the message across. And as dental healthcare workers, we really need not just to focus on providing the safest dental visit, which is what we always do, but to also help our patients understand that what they can do to help prevent community spread and the measures that we can do to reduce the transmission of this new UK variant. Prime Minister Johnson out of the UK was talking about it might be more deadly. You might have heard this on the news. And what he said, and this is actually a quote, if you took a man in their 60s, such as myself, the average risk for 1,000 people who got infected, roughly 10 would be expected to have unfortunately died with the virus, he said. With a new variant for 1,000 people infected, roughly 13 or 14 people might be expected to pass. So it's just the amount of people who are getting the disease, who is getting the disease. But I want to stress it is, at this point, in our knowledge, it is not more virulent. It is not more pathogenic. It will not make you sicker. The NIH weighed in on this, and the director is Dr. Francis Collins, who's been head of the NIH for quite some time. And of course, Dr. Fauci warned that more data is needed to understand this variant. As we remember, we've only had this disease around for a little bit over a year. It changes, and our knowledge base continually increases, which is why we have these webinars every few weeks, so we can help keep the profession up to date on what we know. So this is something that we are going to watch closely. There is no evidence, and I want to repeat this, there's no evidence that the vaccine that I was given in my second dose or the vaccines that you are getting, whether it's Pfizer or Moderna, or if you're going to wait for possibly one of the one-shot vaccines that might be approved next week, we have no data that the UK variant is going to be immune to that. So the UK strain is now in 20 states. It was in 10 states last time we talked. The strain could become the dominant one by March. Get vaccinated if you can. And I know there's been some challenges with vaccines. Be patient. The dental community, we are part of the frontline workers, and we need to get vaccinated as soon as possible. But until then, please make sure you're wearing your N95s that have been fit tested, your face shields, your eye protection, you're practicing great hand hygiene, and you're using many of the tools we've discussed in the past. The Pfizer BioNTech vaccine appears to be effective against the new coronavirus variants, which is very important. It's likely to be effective against contagious variant strains of the virus that was discovered in the UK. Again, it's in 20 states. The Pfizer vaccine is the one that I had. I'm comfortable. The study says there's no biological significant difference in the neutralization activity between lab tests on the variant and original coronavirus strain. The ongoing evolution of SARS-CoV-2 necessitates continuous monitoring, and that's something we've really picked up in this country, of the significance of changes for maintained protection by currently authorized vaccines. So right now we have two in the United States. We have the Pfizer BioNTech and the Moderna vaccines. The South African variant is a little bit differently. It's a little more of concern of the virus because how it impacts the efficacy of our present vaccines. There are currently no reported cases of the South African strain in the United States, which is good news. Dr. Fauci said it's a bit more ominous for this South African isolate because the mutations there make the vaccine not as effective. So you don't get that 94 to 95% protection that you would get against the strains or variants that are in the United States now. But because of the new technology, and I use that new technology meaning that it's been around for 10 years, that within the framework of this technology, the vaccines in the U.S. and the vaccines provide protection against the strain, and they can always be adjusted. It can be modified if needed and a booster if needed. So is this a one and done? We don't know. Will you get your 2 shots and then be fine? Or will the variants change and you might need to get a booster on an annual basis? This is very important information that our government and our scientists are now following. Our dental community is optimistic amid COVID-19 vaccine rollout. A recent survey by the American Dental Association Health Policy Institute found that the average patient volume of dental practices at the end of the year had risen to 78% of pandemic levels. I can say that my practice at this point, based on the technology that I've had and I work in a hospital, we're back up to 100% of our pre-pandemic levels, which is really fabulous. And I'm really proud on the communication that my staff is doing with patients. I will say we're not as booked out as far in advance as we have been in the past, but we stay at 100% capacity, and that's excellent news. Dentists are also eager to get vaccinated, according to another Health Policy Institute poll that showed vaccination is extremely important to 64% of dentists and very important to additional 20%. So 84% of our profession really is eager to get these vaccines. I have a staff member. I'm the second youngest staff member of my team, and all have received the vaccine, including my oldest staff member. Very minimal side effects. We complained about a sore arm, and that's really truly been about it. We're doing fine. Some people complain about being a little bit tired on the next day, and that will be normal. Your immune system is kicking in. You're getting an inflammatory response that might cause aches and pains and things of that sort, or maybe a small fever, but it's gone within a few hours. I think from what I've heard from colleagues, because I do work with physicians and nurses and dentists and hygienists, etc., is the being tired the next day. I'll be frankly honest, I worked the entire next day putting together articles and presentations because of deadlines, and I was able to do it fine. And I'm not the healthiest human in the world, having had some back surgeries and things like that in the past. So also important, and something that I signed up to do, is that dentists have been granted emergency approval in many states to assist with public health vaccination efforts. I am so excited, again, that we are a part of the primary healthcare team. We have so much knowledge. We can do so much to help folks out that when we have large-scale vaccination events, count me in. I will be there. I will be helping our staff, our nurses, our physicians give those injections so we can move this process along. But we can never forget that we're in an at-risk environment. Dental procedures generate aerosol and splatter, and those are two things that we have always been aware of. Pre-COVID, I would put on my face shield, and I have a wonderful assistant, and there still would be some splatter on my face shield. Post-COVID, based on some of the equipment that I'm using, our face shields are clean. There is no splatter. There is nothing on them. And I'll talk about that in a minute. But we do know that we have blood and saliva, and they may transmit pathogens, and that includes SARS-CoV-2. So if we didn't do our mitigation procedures, such as N95s, extraoral aerosol evacuation systems, HEPA filtration, etc., we would have had a bigger problem. But dental offices are doing well. Why? Because infection control has always been at the root of our safest dental visit. The novel coronavirus, as you know, can remain viable, infectious in droplets for several hours and on surfaces for a few days. Dental teams have been encouraged to implement these mitigation practices to limit the spread, and I, again, am proud of our profession. Teams have been encouraged to stop using certain things like ultrasonic scalers and drills. Practices have staggered appointments, and many have implemented robust cleaning regimens. Experts have put forth other innovations. And so this was actually an article, Are You Performing Your Aerosol Generating Procedures Safely? Well, if you look at the things that we have, the tools we have, we've always had high volume evacuation, rubber dams, that's been a standard of our care for some time. We have intraoral shields. And so my hygienists are allowed to use their high-speed ultrasonic scalers because they do have high-speed evacuation with the intraoral shield. They have chairside extraoral suction. We use the Aegis unit. And the newest thing I bought, because I do have some HEPA filters, the newest thing that we bought for my new clinic are these virus killers, and I'm excited about that. I've talked about them in the past. There's this one pass technology that really does get anything we could possibly miss. I want to be safe in my environment for my staff and for my patients. That is my main responsibility, besides performing exceptional dental care. So how effective is a single vaccine dose against COVID-19? I got my first dose. Do I really need to get the second dose? And the answer is yes. And so why is that? Most vaccines, as you know, require a booster to work. That's just how it's always been. If you take the MMR, the mumps, measles, and rubella vaccine, which is given to babies around the world to prevent deadly childhood infections, around 40% of the people who have received just one dose are not protected from all three viruses, compared to only 4% of those who have had their second dose. That is remarkably significant. People in the group that have had both doses, people in the group that have had just a single dose are 4 times more likely to catch measles than those in the group that had both. There have been outbreaks, and we've had some outbreaks in the United States for people who are afraid to get vaccinated or anti-vaccines. The only way we're going to be able to get through COVID-19 is to be vaccinated. And so we have to not only encourage people, but also find ways of communicating to those folks who have hesitancy about getting the vaccine. And there is some interesting news I will cover later on how we're moving forward and how people's perceptions are changing. So how do these booster vaccines work? When the immune system first encounters a vaccine, it activates 2 important types of white blood cells. First up are the plasma B cells, which primarily focus on making antibodies. This type of cell is short-lived. So although your body might be swimming in antibodies for just a few weeks, without that second shot, it's followed by a very rapid decline. Then there are T cells, something we've been working with HIV since the beginning, that are specifically tailored to identify a particular pathogen and kill it. Some of these, memory T cells, are able to linger in the body for decades until they stumble upon their target, meaning immunity from vaccines or infections can sometimes last a lifetime. But crucially, you usually won't have many of the cell types until you have that second meeting or that booster shot. Well, the booster dose is a way of re-exposing the body to the antigens. The molecules or pathogens that trigger the immune system to initiate part 2 of the response. Once you get your boost, you'll have a higher frequency of these memory T cells and ditto to some extent for the size of the pool of your memory B cells. So they'll also be making quality antibodies. So they'll see the virus, they'll be able to attack it and neutralize it. On the second exposure to the same vaccine or pathogen, the B cells that remain from before are able to rapidly divide and create a menacing throng of descendants, leading to a second spike in the amount of antibodies that are present. So you get an increase in the number of B cells, you have memory T cells that are hanging around, and one of the things that we don't know, we know that the B cells, the antibodies formed by B cells, they trail off and might not be as effective, but the memory T cells we really haven't looked at yet on some of these variants because they're further down the line. The second dose also initiates the process of B cell maturation. And what this does, it selects the immature ones with the best receptors for binding to, in this case, SARS-CoV-2. This happens while they're still in our bone marrow, where white blood cells are made. This is going back to our dental school education, and afterwards they travel to the spleen to finish development. This means B cells are not only more numerous afterwards, but the antibodies they produce are better targeted. So we have more efficient and better antibodies after the booster. Memory T cells also proliferate rapidly, and this is an important part of our immune system. They already are thought to play a critical role during the current pandemic, protecting some people from developing a more severe form of COVID-19. Though the virus has only been circulating around the globe since late last year, since December of last year, there has been some evidence, and I think we've all heard it on the news, that our systems may have seen some other coronaviruses before, such as those that cause the common cold, allowing them to recognize COVID-19 and help neutralize the bad impact of it. So how effective is a single dose of the COVID-19 vaccines available in the U.S.? So the Pfizer-BioNTech, they published data in December that one shot is roughly 52% effective after the first dose. So when you get your first dose, you will be 52% protective. Does that mean you can be 52% less cautious? No. Still do all of the things that we've been doing. Do I still mask up every time I'm on Grady property after the second dose? Yes. Do I still stay physically distanced as much as possible? Yes. And do I wash my hands numerous times a day? I'm a dentist, and the answer is yes. Of the 36,000 participants in their phase 3 trial, the final stage of testing, whether people received 2 full doses 21 days apart or placebo who had no evidence of existing infection, 82 people in the placebo group and 39% or 9 people in the vaccine group developed symptoms, but not severe symptoms. The protection does not kick in until day 12. So when you get your second vaccine, you're not immune. It takes 12 days. Honestly, it has not been 12 days for me. And so we'll see how things progress. But I will still follow all of the procedures to remain safe. So until you get that second protection, again, 12 days later, there's no difference between the two groups. One dose is still significantly protective, less protective than 2. The latter is 95% effective in preventing the disease after a week. Moderna, according to their company document submitted to the FDA, the Moderna vaccine can provide 80% protection after 1 dose compared to 95.6% after the second. And this is in people ages 18 to 65, and it's a little bit less. It's 86.4% for those over 65. It's still pretty darn effective. Now, the CDC has made some changes. If you've turned on the news lately, you know we're running into some production problems and some distribution problems. Hospitals aren't getting exactly what they need. There are people who have to wait longer for their second dose. So the CDC actually changed how the schedule can be. And we initially did it based on the research that was done by Moderna and Pfizer and what was submitted to the FDA. But now they say that people who have received their first dose of a coronavirus vaccine can schedule their second shot up to 6 weeks later if they are not able to get one in the recommended time frame. So if you're running into problems with scheduling, you're running into problems in your city or your state with a vaccine, then you can wait up to 6 weeks. Under very limited occurrences, you can use one vaccine to start with, say Moderna, and then switch to Pfizer. That's not recommended. What really is recommended that you stay with either Moderna or Pfizer at this point, as there are 2 recommended and FDA EUA approved vaccines. However, the CDC reported that the recommended dosing interval of 3 weeks for Pfizer and 4 weeks for Moderna should still be followed in the vast majority of cases. So our hospital, what they have done is if you got shot 1, they have put aside enough for you to have shot 2. And so there's no concern here. And I think our counties and our state are operating under that philosophy that if you get in shot 1, we'll hold back shot 2 for you. So we have some new information coming out on a brand new vaccine that will be available, which is Johnson & Johnson's COVID-19 vaccine. So soon, possibly even next week, we'll have a single dose vaccine that might be FDA EUA approved. It's a recombinant replication incompetent adenovirus, so like a cold vector involving a full-length and stabilized SARS-CoV-2 spike protein, just the spike protein. The vaccine was derived from the first clinical isolate from the Wuhan strain from 2019, that whole genome sequence. It's the vector that's used in the Ebola vaccine that was approved by the European Medicine Agency and in vaccine candidates against respiratory syncytial virus, HIV, and Zika. AG26-based vaccines are generally safe and highly immunogenic. The vaccine is one of the most closely watched vaccines that we have because it's a single shot, and most people don't want to get multiple shots. And it's also, you don't have to worry about that follow-up visit. So it's a single dose shot to be relatively easy to distribute based on data from their phase 1 and phase 2 trials, which is what we have today. Now, next week we'll have more information. Out of 805 participants, the vaccine generated a long-lasting immune response with 90% of the participants generating neutralizing antibodies against the coronavirus. So different technology, one shot, you get 90%. More conclusive efficacy data from J&J's phase 3 study will be available possibly as soon as next week, and it involves 45,000 volunteers, and the company is likely to proceed with emergency approval. The first single-dose COVID vaccine could get emergency approval, as I mentioned, just as soon, and Dr. Fauci said it would probably be less than 2 weeks now that the data will be analyzed and decisions made. So this is actually new, encouraging information. What makes this vaccine special besides the fact that it is just a single shot? It can be stored at refrigerated temperatures, so it doesn't need to be sub-zero, which makes it much more difficult for more rural areas, for non-hospital-based programs, non-research-based programs. It will be shipped in a 5-dose vial that does not require dilution. Our present vaccines that we have to dilute. J&J has agreed to supply 100 million doses to the U.S., 200 million doses to Europe, and 100 million doses to developing countries. There have been reports of the company seeing some manufacturing delays, and while they are expected to deliver 12 million doses by the end of February and by 100 million by the end of June, it's possible they've fallen behind their goal a month or two, but that's really not what their CFO was just saying. So the real goal is to meet the United States 100 million by the end of June, to get 100 million doses of the J&J vaccine available in this country by the end of June. The company is planning to onboard 7 factories by the end of the quarter to meet the U.S. commitment and fulfill the European order by the end of the year. Shipments to developing countries will begin at the end of the year. The company is also testing a 2-dose regimen of the vaccine, and the results are expected later this year. So what we've seen is we know with 1 dose we get 90% coverage, which is pretty darn good. And now they're looking at a 2-dose, but we'll have that 1 dose available that we can get to people in more rural, more frontier areas, or people who just prefer to get 1 shot where it's more difficult, maybe going into nursing homes, etc. So where are we looking from last December, and where are we with people's desire to get the COVID vaccine? So if you look in December of 2020, very few people had had the vaccine. As of January of 2021, about 6% of folks had had their complete vaccine. If you look to the number of people who want to get it as soon as you can, that's 41%. So you actually have 47% of the people who are willing and really anxious to get this vaccine. That's important, compared to 34% in just December of last year. To wait and see how it'll work, and I do have a couple of people on my staff that are in that category. That number went from 39% in December of 2020 down to 31%. Then there's the group that is get it only if it's required, and that's 9% in December. It dropped to 7%, and definitely will not get it has dropped some. So there will be vaccine hesitancy. One of our roles in the dental profession that we can talk to our patients about is try to overcome vaccine hesitancy. There have been some anti-vaxxers who have put out some information that might scare the public, and it's our job as part of the scientific and primary care community to really get the right information across to our patients so they'll have a very positive outcome and want to get vaccinated so we can end this disease state and return to some sort of normalcy as soon as possible. So thank you for your time. Our next webinar is going to be a little bit different. It's going to be live, and we really want to hear what your questions are. So please submit questions or please come up with questions. I'm sure Dr. Severance has talked about that already, and we'll talk about it again, but we want to hear what you, the listeners, really want to know, and we'll do our best, Dr. Severance and myself, our best to answer and address those questions. As always, it's been an honor and privilege to be with you, and I look forward to the live presentation in 2 weeks. Thank you.
Thank you, Dr. Reznik, for the continual updates. We hope you'll all join us for the next session on February 12th at 2 p.m. Eastern Time, as we host a live Q&A with Dr. Reznik. Remember, to submit questions, please go on the link shown on the screen now. It's also available in the description of this video. And as always, if you have any questions, concerns, or topics for future episodes, please email us at webinars@henryschein.com. And please subscribe to our YouTube page by clicking the subscribe button below. We're back next time answering your questions live, so please send in your questions. Until we see you again, stay safe and stay informed.